What role does neuroplasticity play in early intervention for kids? Imagine a young brain as a busy construction site, full of potential pathways waiting to be built. Every experience, every activity helps shape these pathways. That's where neuroplasticity comes into play. It is the brain's ability to change and form new connections. This ability is strongest during early childhood, especially in the first 2 to 3 years of life. During this time, the brain is like a sponge, ready to absorb new skills and information. When children engage with their environment through movement, talking, or playing, their brains create new connections between neurons. These connections are like tiny roads that help the brain send messages faster and more efficiently. The more a child practices a skill, the stronger these roads become. Over time, simple trails turn into busy highways, making learning easier and faster. Early intervention takes advantage of this window of high neuroplasticity. For children with genetic conditions or developmental delays, starting therapy early can help the brain develop alternative pathways. This means that even if some parts of the brain are affected by a genetic condition, other parts can take over and support important skills like talking or walking. This can help children reach key milestones sooner, such as saying their first words or walking independently. Therapies like speech therapy, occupational therapy, and applied behavior analysis are designed to stimulate the brain and reinforce new skills. For example, repeated practice in speech therapy helps children connect words to objects or actions. Occupational therapy might focus on improving motor skills by encouraging activities like grasping or balancing. These targeted activities help the brain build and strengthen the necessary neural pathways. The earlier these therapies begin, the better the chances of making a real difference. As children grow older, their brain's ability to change decreases, making it harder to develop new skills. Waiting too long can mean missing the best time for the brain to adapt and reorganize itself. That's why early screening and diagnosis of genetic conditions are so important. Detecting issues early allows families and healthcare providers to start intervention right away. Understanding how neuroplasticity works highlights the importance of acting quickly. When intervention is tailored to each child's needs and started early, it taps into the brain's natural ability to learn and adapt. This can lead to better cognitive, social, and physical development over time. It's like giving a young brain the best tools and opportunities to grow strong and resilient from the very beginning.